Hi, everyone. We are now on our Unit 6 of the first module, which is all about the importance of communication skills. And this is one of the very important topics that you should be able to have a discussion with. But before we go into discussion, I'm going to have a lecture. And after this, we will meet up again and then we have to discuss we have, what I have lectured with this time. Okay, so let's start. So the importance of communication skills. The objectives are as follows. In this chapter or in this unit, the trainees are expected to define communication, describe the two major forms of communication, and give examples of each. And then discuss the techniques that promote effective communication. Then you have describe blocks to effective communication, discuss methods used to avoid them, identify causes of conflict, and discuss ways of resolving conflicts. Demonstrate proper telephone communication skills. Discuss the methods of reporting and recording information in a healthcare setting. And also, at the end of this lecture, or of this unit, you are expected to explain how the patient's or residents' medical records make communication easier among members of the healthcare team. Then describe communication technologies that are being used in the healthcare field today. You are also expected to explain why the nursing assistant is a vital link in the communication chain and describe how the nursing assistant communicates information to other members of the healthcare team. And list the steps of the nursing process and describe how the nursing team uses the nursing process to plan the patient's or resident's care. Understand the role of effective communication in the provision of quality health care. Okay. So those are our objectives. Now, what is our aim in discussing this? We aim to improve the experience of healthcare for people with communication difficulties. So, in this unit, our aim here is for you to be able to increase awareness of communication, to gain knowledge of different communication disorders, to understand the role of the speech and language therapist, and to improve skills in communicating with adults with communication disorders. Not only with adults, but you also have to learn how to communicate with the children. Okay, so now let's have, what does communication occur? When does communication occur? Kailan ba ito nangyayari? Okay. One is communication occurs when people share information with each other. Nag-uusap sila, nagpapalitan ng kuro-kuro o nagpapalitan ng informasyon o di kaya kahit sa pakikinig, no, sa radyo, sa TV, kung saan ikaw ay nakakuha ka ng information, then communication is actually it's there, no, it's occurring. Or there are two methods people use to communicate: verbal and non-verbal. No, these are the two methods of communication: verbal and non-verbal. Later on, we're going to discuss on what verbal and non-verbal is. So, what is communication? We have to understand communication skills and what communication is all about. So, when you say what is communication used for, okay, ano bang gamit ng komunikasyon? You have to satisfy needs. Okay, ano ba yung needs na yon? So, if you can go back to our hierarchy of needs, which is actually part of that is the physiological needs. No, pag nagugutom ang tao, syempre magsasabi siya na, oh, nagugutom ako, paglutom ako. Di kayo pagka newborn naman, bata, dinadaan na sa pag-iiyak, di ba? So kapag ka umiiyak sila, sasabihin mo kagad na, oh, kailangan ng gutom na siguro yung bata, kailangan na painom ng gatas. So this is actually communication is used to for the satisfaction of the needs. Like if your stomach is aching and you need some medicine, then you can also have communication be there. So, kailangan lang natin tingnan kung ano yung mga needs na yan. So, you have physiological needs, you have the safety needs, love and belonging, self-esteem, and of course, we have the highest one, which is the self-actualization. So, there are these following needs that I have already discussed, which is all about the hierarchy of needs. We need communication para magkaroon katugunan kung ano yung ating mga pangangailangan. Katulad ng pasyente na nangangailangan ng oxygen, ang kanyang komunikasyon sa pamamagitan ng aksyon niya na nahihirapan siyang huminga. So, uh, naiintindihan kaagad natin na kailangan niya ng oxygen. Then social interaction, kailangan natin makapag-usap, no, sa mga tao sa kapaligiran natin o mga tao na kapaligid sa atin. Kailangan natin na ang komunikasyon, no? We need to communicate with them. And then we have self-expression. You need to express yourself. Like for example, if you're in love, if you are sick, if you are, whatever is your feelings, whatever is your the emotions that you have, then you can actually express that, communicate that through maybe verbal or non-verbal. So self-expression or controlling, reasoning, and problem solving. So when you'll be working in the office, pag nagtatrabaho ka sa isang opisina, no, and there is actually if there is a case or an issue, and you have to reason out, and if there's a problem, you are going to have a problem solving. So this requires communication. No? Makipag-usap ka, tawagan mo siya, sumulat ka, mag-email ka. These are types of communication. Seeking or giving information, nagtatanong ka, no? Like for example, hindi mo alam kung ano ang peg tube, so magtatanong ka and somebody will tell you, peg tube is like this, what is tracheostomy, or what is an NGT, or whatever you are not aware so much in terms of your work, then you can ask your supervisor or the nurse or the doctor if what is that all about. So that is actually part of communication. So seeking and giving information. Seeking, giving consent. When you say yes or no, okay, like for example, if you will be asked to, okay, can you please go to ground floor and get some samples or submit some samples of the patient, like that. So when you say yes, then you are actually seeking or you are giving consent. Okay? So pumayag ka through communication. Channel for imagination or creativity. Communication is actually makes the people who are very creative to imagine. No? Nakipag-communicate ka sa nature mo, ito-drawing mo siya, o nakipag-communicate ka sa isang medium, no? Na kailangan mong, so magkakaroon ka ng creativity. Ini-imagine mo, ito siguro yung dagat, ito yung ganito. So you can paint already or you can create your own story, no? And then you have entertainment. Communication is very important in the entertainment world. Like you have MCs, you have hosts, you have artists, you have actors and actresses, and they use communication in the entertainment. Even the songs that they sing, even the singers who sang the songs, then they are actually communicating in terms for in the field of entertainment. Okay, verbal and non-verbal communication. Now, when verbal and non-verbal messages match, no? Yung sinasabi at yung kanyang kinikilos, they can help to make a message clearer. Okay. If the verbal and non-verbal messages do not match, the other person may become confused. Like for example, sumasakit ang tiyan, sabi niya sakit na masakit pero nakatawa pa rin siya. So there is no match between nagkakasakit siya ng sakit ang tiyan niya at yung kanyang facial expression. Diba? So, dapat magmamatch siya para mas clearer yung message na gusto mong iparating o ipaabot sa receiver. So when you say verbal communication is getting a message across through the use of the spoken word, written information, or American Sign Language. So magsusulat ka o magsasabi ka na, ma'am, mayroon pong problema yung pasyente. Sabi niya kanina yung pasyente, masakit yung tiyan niya. No? So ito yung ginagamit mo ngayon, yung spoken word, para masabi mo ang information na yun sa iyong kapwa sa iyong kapwa caregiver or sa iyong nursing supervisor or director, no? So it can be spoken word or written information or American sign. Ano ba yung American sign? Like for example, yan, American sign yan. So this I love you. A, B, C, D, okay, E, F, ganon. So these are actually what we call the alphabet, okay, the alphabet in the American Sign Language. Then you use verbal communication when you talk to patient and answer the telephone, or or you can actually communicate with the patient or the person by writing. Okay, you can ask him that, can you please write down here so I can understand more. Okay. Now, we see nonverbal communication is also called body language. Nonverbal communication sends a message across without the use of words. Facial expressions, You have gestures, posture, and tone of voice, and touch are examples of non-verbal communication. Like for example, here in Saudi Arabia, no, gumaganon sila. Ganon. So, which means that wait for a minute or wait. Okay? Okay? Or when you say that's like this, ishada, what is it? Okay? Or taal, okay? Which means let's go. So these are actually to make their message be able to get across, okay, across through the gestures, then they're going to actually use this the body language, no? And then when somebody, pag may isang tao naman masakit ang tiyan ko, the facial expression will tell you also kung gaano ka severe, gaano ka sakit yung nasa tiyan niya, no? O gaano ka sakit ang tiyan niya. And then yung voice, no? Pag ikaw ay isang caregiver na pagpasok mo sa kwarto ng iyong pasyente, the tone of your voice, okay, can be therapeutic, or it can worsen the situation or the condition of your patient. Like for example, pagpasok mo ng kwarto, good morning, hello, good morning. Okay. So kaysa naman, hello, good morning. No, 'di ba? So magkaiba 'yon. So, which one are you going to use when you're facing with a patient? Kahit na gaano pa kabigat ang problema mo, you still have to be composed. Ibig sabihin yan, kailangan nandyan pa rin yung pagiging marahan mo, no? Pagiging magalang mo sa salita mo. Because this is, these words are actually very effective, no? Okay. So, uh, pag nag-good morning ka, tapos iba naman yung itsura ng mukha mo, then that is what we call the non-verbal and the verbal are not matched. Okay? So voice and touch are examples of non-verbal communication. Yung mga tinatapik mo lang sa yung sa shoulder yung kanya yung pasyente, how are you? That would mean something to them. Okay? The non-verbal communication is used almost 100% of the time. Now, we have also some methods of communication. So, if we understand communication skills, there are some methods that we need to also to understand how these methods will be used. Like, for example, the first method is writing. Okay, so you can write a love letter, or you can write a letter to your boss, to your friend, by communicating. So, meron kasi iba na hindi kaya magsalita, which is actually verbal. So, pwede ka magkaroon ng chance na makipag-communicate. Ano pa rin siya, verbal, but through writing. Okay. We have reading also. Reading is very important because, if you keep on reading, then the more information that you're going to absorb, the more you will become aware of what you're doing, if it is right or not. Okay. Drawing. Okay. One of the ways that people communicate to each other, especially when your patient has a difficulty in hearing, then you can actually have a drawing board. Okay, so the drawing board is actually, if you want to say, okay, you want to eat banana, so you can drink. You can actually, you as a caregiver or nursing assistant, you can draw the banana. Okay, and when they see it, they can recognize it. Now, listening. Now, this is actually one of the very, what you call, not so easy way of communicating or method of communication, which is listening. Because somehow our brains are processed on how to understand the things that being told to us. Like, for example, no, through listening, you should be able to be aware and you should be very on your sense to understand it. Kasi kapag ka nagkamali ka sa napakinggan mo, mali na lang information na i-deliver mo sa iba. Okay, so listening is very important. Or gesturing, we do that here in Saudi Arabia, gesturing. Or technology, you have the Facebook account, you have Twitters, no, these are the social media. Or your computer itself can be a tool for having a method of communication, okay, which is the technological method of communication. Eye contact. When you say eye contact, when you talk to the person, you as a caregiver or nursing aide, you have to talk to the person eye to eye para makita niya na you are very sincere and yet you are so serious about what you would like them to understand and what you like them to do. Okay? The music is therapeutic, no? Therapeutic. When you listen to the music, sometimes natutulog ka na. Or if you're going to listen to the music, everything will calm down. Okay? So that is actually it has a psychological effect. The music, no, siyempre tugtog ka every morning, no? I can still remember in the Philippines, in the morning, my father would open the news, and then we just listen to the news. Okay, so touching, no? Excuse me, tapping the when you tap the shoulder. Okay, when you tap the shoulder, or when you're going to hold the hands, then that is actually part of or one of the methods of communication by just touching. The tone of voice, yung sinabi ko kanina sa inyo, baka mamaya masyado akong bass, no? Or doktor, or sir, no? Nakakatakot minsan yun sa pasyente. Then you really have to exercise and practice on how to have a voice or regulated tone of voice, no? Regulated. So modulated and regulated. Yan. Body language. Okay, body language, hindi yung sayo na body language, but this is actually how you're going to make use any part of your body to convince the one who is listening to you. So that when you cross the message with the body language, then everything will just be understandable. Facial expression. So just like I've said, when you ask a patient who is suffering from stomach ache, and then you have to check, is the facial expression really painful for him or for her? Or from there, you can actually validate your what we call the assessment, no? For having a communication. Okay. So these are the methods of communication: writing, reading, drawing, listening, gesturing, technology, eye contact, music, touch, tone of voice, body language, facial expression, and writing. Just remember that what you have actually enrolled is a caregiving and nursing assistant, in which you are supposed to be exposed to the society or the community. That is the reason why you have to develop such communication skills. Okay, so we have here the methods of communication, but the methods of communication will depend on the demand. Ano ang demand? Like for example, paano ka makapagturo ng ganitong level, no, level 6 na siya, eh ang estudyante mo na sa level 3 pa lang. So hindi siya magkakatugma. That is why you have to understand communication skills. Okay? And then, to become a good listener, to be a good listener, listening is an important part of communication. It is an active effort to hear the message and understand it. Listening requires concentration and attention to what is being said. Yes, especially when you're at work, and then you are doing some things in your mobile phone, and then the doctor would say, "Please go to Miss Clara and do this and do that and do this and do that." So there are four procedures, but you did not listen. So since you did not listen, you don't have any idea, or if you have any idea, it's just a little bit of idea for you to be able to perform your task. Okay. So when are you going to listen, or how are you going to listen? Stop talking. You cannot listen if you are talking. Always remember that. Kung may kasama kayo sa bahay, sabay kayo mag-uusap. Kung may naintindihan ka ba kung ano ang kanyang sinasabi sa'yo. Di ba? Ganun yan dito. Put the speaker at ease. Help the speaker feel free to talk. So you have to close, if there is a sound system, okay, operating sound system in the room, then you have to lower the sound of that sound, that the sound of that songs, or the sound of that what you call the music. Then you really have to lower it down with respect to other people with different uh, what you call belief. No, remove distractions. Don't doodle top or shower papers. Shut the door if it will be quieter. Okay, so when somebody is watching the TV outside of the bedroom, they can close the bedroom so that you can maintain actually a uh, time to each other as the patient, as a caregiver, to know what are the different um, what is the different, or what are the different characteristics of that of the wife, no, or of the husband. So it will depend. Put the speaker at ease. Do kailangan naramdaman ng speaker na talagang nandito ka pa, huwag ka mag-alala, nandito lang kami. Diba? So that's what we call actually putting the speaker at ease. Show the speaker that you want to listen. So what will be your gesture? Sometimes talaga nagli-lean forward ka because you are interested. No? Pag interesado ka kasi, hindi yung pupunta yung mata mo dito, pupunta mata mo dito. No? You have to have the skills of looking at the picture, or looking at the face and the eyes of the one who will actually conduct the meeting with you. Okay. Now, kailangan wag ka ganun, no? Gumaganon-ganon ka sa table ng top ng ball pen or shuffle papers, pinaglalaroan mo yung papel, no? So, you have to avoid that one. Empathize with the speaker. Empathize, ibig sabihin, ilagay mo ang iyong sarili sa sapatos ng iyong pasyente para maramdaman mo ano nararamdaman, ano nasa isip niya. So, once you are going to talk to the person, to the patient, you would know that, ito pala yung kulang sa kanya. So, I will ask for a, to provide something that could actually um, uh, to become a good listener. Okay. Be be patient. If you want to listen, you have to listen. Be patient. Don't cut her or him during the course of discussion because that will actually insult him. Allow, okay, you have to allow plenty of time. Hindi lang isang oras, hindi lang dalawang oras. So, huwag mong damamadaliin. Pagkuha lang ng mga details or information. Do not interrupt. Okay, do not start for the door or walk away. So, huwag kang magsisimula sa may pintuan. Pagpasok mo talaga, dapat doon ka pa magsisimula. Okay? And do not interrupt. Huwag mo siyang, uh, huwag mong, what do you call this? May gagambala sa inyong, meetings, then that is not good. You keep your anger under control. So when you're going to have some discussions or argumentations, huwag kang magagalit kaagad. Okay, bawal yan. So kailangan marunong kang magpa-ilalim minsan. Hindi lang pwedeng magpa-ibabaw. Okay, an angry person gets the wrong meaning from words. Okay, kasi kahit ano explain mo, ang nakakarating sa kanya, pagka ang perception niya is mali yun. Okay? Or hindi siya tama. So kailangan pag-aralan mo kung paano ka makipag-usap doon sa tao na nakaalitan mo ba and everything. So hayaan mo siyang magkalat, but you will be the one to fix it. Ask questions, encourage the speaker, and show you are listening. Questions also help to develop further points. So when you will be having your lectures, you can ask questions, or even in the discussion, you can ask questions because when you ask questions, the more it will be clarified, the more you will be able to absorb the lecture. Stop talking. Okay? Stop talking. Ibig sabihin, huwag ka na magsasalita kasi meron nang naiuna sa'yo. Magkakadoble-doble, magkakaroon ng iba't ibang uh, pag-intindi. So that is one thing that we have to avoid. So, guidelines for effective communication. Ano bang dapat na gawin na para magkaroon ng effective communication? One, reminiscing is a way of reviewing life. No? Reminiscing. Binabalikan mo yung mga panahon na, ay, ganitong panahon ko, tapos ikaw ay nag-aalaga ka ng isang matandang babae. So you will tell her your stories, no? Review. Like, it is a method that is sometimes used when communicating with elderly. You can actually ask, so where's your daughter? No, how does she look like? Okay, before. So, pero alam mo na ganun, pero actually at least meron pa siyang maidagdag sa iyo na information. Okay, some people can talk to a pet, no? Kaya nga meron tayong may movie na Pet Cemetery, no? O di ka yung pet kasi natin, you can actually talk to them as they said because they can act like people like us. Okay? So it will also help you to maintain your sanity, especially now that there's COVID-19 and we need to be quarantined, isolate ourselves. Now remember, when you communicate, you are not only conveying words, but also your attitudes and feelings about yourself and others. So kung meron kang problema, lumalabas yan sa mga salita mo. No? Pag meron kang kaalitan, lumalabas pa rin yan sa iyong communication. Okay? So kailangan, pag-aralan natin ano bang bibitawan natin sa salita bago tayo magsimulang makipag-usap. Now, what are the barriers that limit communication? Okay. Now, when you say barriers, it is something that will serve as a wall, while on that one side is the people from Saudi Arabia, and the other side will be coming from other nation like the Israel or whatever. So, if communication is not taking place, explore the reasons why. So, when you're going to explain you know what we have a caregiving course there in Jeddah. You might be interested. So is the what will be your expected explanation of the person? Okay. So kailangan, okay, nagkaroon kayo ng kung magkakaroon ka ng barrier, like for example, knowledge, no? Hindi kayo magkaparehan ng dunong. So that can also be a cause or a barrier, no, that can limit the communication. Okay, so you have here Yeah, a person's language, culture, or personal beliefs may affect their ability to communicate effectively. No, like for example, magkaiba kayo ng kultura, magkaiba kayo ng lingwahe o dialect. We have 111 dialects in the Philippines, and if you are one of the, if you have got one of the 111 dialects, and the other person has another dialect from 111, there's a possibility that they will not be able to understand each other. Hindi sila magkakaintindihan. Bakit? Una, magkaiba ang kanilang salita, iba ang pagkakaintindi. Okay? So may personal beliefs ka rin, may affect the ability to communicate effectively. So like for example, your mother, I mean the uh, like for example, if the person is or the patient is uh, they have their own belief, they have their own culture sa pamilya. Sasabihan mo siyang ganito, ganyan, then he will actually create, no, a problem or issue. Why you did not give me this? Why you did not do this to me? This is what I am requesting for. But because there is a culture, no, na hindi naintindihan siguro or mali ang pagkaintindi, hindi nagawa. Okay, so nagkakaroon tayong limited communication because of the barrier. Now, barriers to effective communication, ano ba yon? Ano mga barriers? Harang, no? Harang. Barriers are harang. Like, changing the subject, no? Pag once na nakikita niya, ay, ayoko pag-usapan ng mga bagay nito, nagsiswitch ka na kaagad ng ibang topic o yung subject para hindi mapag-usapan yung na unang topic. Okay. Kunyari, umutang ka. Pagkatapos, sabi niya, oh, mag-uusap-usap tayo. And then, pagdating mo doon, nag-usap nga kayo pero naalala mo may utang pala ako dito sa kanya na malaki na baka may mababanggit. So kumuha ka ng chance doon para ma-change yung topic. So yun ang tinatawag na barriers to effective communication. Okay, belittling. Okay, giving your own opinion about the person and institution without being asked. Ang tawag niyan unsolicited opinion or unsolicited idea. So kung may problema, huwag kang sasabat-sabat ka agad kung hindi mo lang din alam ang sitwasyon. Okay? Your opinion about the person, kasi meron ka sariling opinion eh, dapat sana ganito niya, ganito ang ginawa niya. What if yung situation mo is hindi siya suit doon sa pangangailangan ng, what you call this, like, uh, hindi magsusut doon sa anong tawag nito, sa communication relationship ng pasyente at saka ng caregiver. Kasi nga magkaiba sila. So magkakaroon ng discrepancy. You know? And then we have also belittling a person's feelings. Kung nakipag-communicate ka, huwag ka magsasabi na, ay nako, wala kang sinabi, wala kang binatbat. This is actually very bad. Okay. Seeming too busy. Para bang, ay mamaya na kasi may ginagawa pa ako. Ay ganito lang, 20 minutes na lang, may ginagawa pa kasi ako. Now, this is actually a barrier to effective communication. Mamaya na tayo mag-usap kasi medyo busy ako dito, pero hindi pala. Okay. So it will actually ruin the effective communication. Jumping to conclusions before you know the entire story, isa ito sa mga bagay-bagay na nagkaroon na siya ng parang chismis, kaya meron tayong cyber, we have a cyber law wherein it can punish or given the authority to punish those individuals who are not, uh, what do you call this, who are actually uh, not following the protocols or not following the guidance or the direction. It might harm your patient. Okay, so giving false or inappropriate reassurances. So you are not supposed to tell your patient that, oh, after today, tomorrow, you will have your uh, you can enjoy already outside because you will be discharged. Pinangakuan mo siya, pero tapos pagdating na araw to, hindi pa pala. No? So that is actually a barrier of communication. Giving false or inappropriate reassurances. Okay, so if you will encounter this, na yung bang sasabihin ng kumpanya sa'yo, okay, I'll give you this one, I'll give you that one, I'll give you this. That is actually a reward. Okay, it's a reward. But you are not supposed to conclude on that. No? So kailangan kasi na meron kang tinatawag na true reassurances. So dapat magbigay ka ng assurance, hindi yung false or inappropriate reassurances. Or interrupting, isa din ito sa mga barriers ng effective communication. Interrupting. Nagsasalita pa lang ako, ang dami mo lang sinasabi ka agad. So hindi tayo magkakaintindihan yan. So that is what we call not waiting, or interrupting. Not waiting long enough for a reply. So minsan kasi nakipag-usap tayo, parang Oy, bakit di siya nagre-reply? Oy, bakit ganito? Parang hindi siya interesado sa pag-ano ko. So you have to be very uh, observant in the reaction of your patient if you're going to use this language. Is it okay with them or not? Or you can ask them. Okay? And pag nag-aano sila sa'yo, nag-i-inquire, huwag ka dapat ma-address kayo yung query ka agad within 24 hours. Otherwise, after 24 hours, panis na ang kanilang hinihingi na mga information. Using words that sound alike or having different meaning to the center, to the receiver rather, that the sender intended. For example, plane. No, ang plane, meron ka kasi plane na airplane, merong plane na wide, open field, ganon. So kailangan alam mo at kailangan malaman mo na ito ba yung dapat na sabihin ko na plane. So make it complete airplane, the one that flies. Okay, plane is just like an open field. So kailangan alam mo kung paano pagsabi ito sa pasyente mo. Now, what are the possible causes of a communication disorder? You have stroke or CVE, no? It's actually cardio, cerebro, it's actually cerebrovascular accident, no? Cerebrovascular accident, meaning there's a stroke. Okay. Traumatic brain injury, nabangga sila, nagkaroon ng injury ang utak niya, no? So this will actually affect the communication of the communication skills of the person. Dementia, nakakalimutan niya na, so hindi niya maalala, it will actually create confusion. So kailangan maintindihan mo at hindi ka dapat magalit kapag ang pasyente mo ay actually merong problema sa kanyang pagsasalita o pag-intindi sa mga salita. No? Ito nga, dito, no? Dementia, nakakalimutan, ganyan, makalimutin. Yan. Progressive neurological conditions like Parkinson's, no? Parkinson's can also cause problem in terms of communication. Okay, multiple sclerosis and motor neuron diseases. Now, this will be discussed to all of you when you reach the module wherein a discussion and lecture about uh, confused and mentally ill or challenged patients, no? Mga mentally ill or patient, ayun sila. Kasi meron din silang mga attitudes because they cannot actually communicate well. And you have the head and neck cancer or laryngectomy, yan, no? Nag-iiba ang boses niyan. Tracheostomy, hindi ka talaga basta-basta makapagsalita kapag ka meron kang tracheostomy. Other causes like mental health, anoxia, infections, and high fevers. Ito yung mga dapat tandaan natin kapag ka may mga problema ang iyong kapatid ba or kahit na sino man, sa kanyang pagsasalita, dapat i-report ka agad sa doktor. So may mga tinatawag na communication difficulty. Ano ba yung communication difficulty? Ano nagpapahirap sa communication? Cognition, yung pag-intindi. No? Cognition yung pag-intindi. Aphasia, dyspraxia, dysphonia. Itong apat na ito, itong tatlo pala na ito, or apat na ito, like dysphonia, dysarthria, dyspraxia, and aphasia, actually, ito yung mga iba't ibang klase ng disorders, no? It can be inborn, it can be acquired ng isang tao kung bakit siya ganito magsalita. Okay. So let's start with aphasia. No, aphasia is actually a language disorder, receptive difficulty with understanding spoken words and or reading. Hindi niya alam ano sinasabi niya. Yun lang, no? Meron siyang language disorder kasi hindi niya masabi kung anong ibig sabihin nito, ganyan. Difficulty with talking and or writing. Yan. Nahirapan siya magsulat at nahirapan din siyang makinig, no, at magsalita. People with aphasia may have problems understanding the meaning of words. No? Pag sinabi mong boy, iba ang meaning para sa kanya ng boy. So isa yan sa mga patients with aphasia. Put words into fluent sentences which make no sense. The beast is the fit. The beast is the fitting in the old tunker. No, it's very unusual and very inappropriate. No sense. Or produce nonsense words. No? Now, confuse words with similar meaning, like for example, plate or cup. No? Magkaiba yan. No? So, plate or cup. So, dapat alam niya, dapat ipakita mo na ito ang plate, ito ang cup. Kasi nakakalimutan niya na yan. Okay? Or jelly tortelli. Yan. So, kailangan i-spell. It's jelly, letter J-E-L-L-Y. Letter T-E-L-L-Y is telly. Okay. So have difficulty finding the right words. Nahihirapan siya maghanap ng words na yun. Meron na siya na-compose pero una sabi po nakakalimutan yung mga tamang mga salita na dapat gamitin dito. Have difficulty producing more than a few words. Have difficulty producing grammatical sentences like shopping home later. No? Later for shopping
So
home.
what's your name?
Okay, let's have this one as an example.
Scott. Oh, no. Sarah Scott, that's right. And how old are you? I can't. Try. I can't. You're 19. 19. Yeah. And what happened to you? Stroke. School and English class. Okay. And I book and I read it aloud. But I can't because stroke. And what happened after the stroke with your speech? Well, I can't. What do you do now? Every day? Oh, speech, then, the speech therapy. Yeah. Okay. And also riding. Riding what? Oh. Horses. Yeah, good. And how do you feel? I'm fine. You're fine. That's good.
Okay, so you see, that is what a person with aphasia. She doesn't know the words. She cannot actually remember the words, the appropriate words that she's going to use. She doesn't even know that what is her age. No, so that's what we call aphasia. Okay, we have also dyspraxia. Okay, now dyspraxia is a disorder or of planned and coordinated movement, causing people to have difficulty saying what they are consciously thinking about saying. Errors are produced when saying words like, for example, cat. No, uh, they said that cat. They will tell cat. Hospital. They would say hopistal. Speakers are aware of their errors and try again. So they are going to re-utter. No, sasabihin nila ulit yun. Na cup, a cat. Okay, hospital, hospital or hospital. Gano'n. So alam nila na mali. No, kaya kinokorek nila yan. Words are often produced differently each time. Like for example, hospital, hospital, o hotistal. Okay? So hindi niya makuha yung tamang word talaga. Speakers are able to perform involuntary movements, pursuing their lips for a kiss, but struggle to close their lips to produce a P for speech. For example, this one.
Okay, Cash, can you tell me how old you are? You're 3? Wow, can you tell me your name? What? Your name's not Dad. Silly. Can you say Cash? Good try. What did you do today? You swam? Swimming? Can you say bubble? No. Bubble? Oh, you blew bubbles in the water? Yeah. Can you say bubble? Yeah. Say it. Yeah. Bubble. Fell into? Yeah. How old is Fallon? 1. Do you guys like to go swimming? Yeah. What else do you like to do? Truck? What? Oh, the park? Yeah. You like to go to the park? Can you say park again? Park with a P. Park. Good try. What's your favorite thing to do at the park? Play? on the slide? Do you like Dad to come to the park? Wait here. Where are you going?
Okay, so that is dyspraxia. The boy has a dyspraxia. He actually cannot pronounce P, and he has difficulty of saying the words, no? Ganyan yung mga bata may dyspraxia. Okay. The other one is dysarthria, a motor speech disorder characterized by weakness and incoordination of the speech muscles. It may be acquired in addition to dysphagia and or dyspraxia, or it may occur in isolation. Now, the presence of dysarthria can sometimes make it difficult to establish if there is any aphasia. The characteristics of dysarthria can depend upon the area of the brain kung saan banda ang may lesion, no? Kung saan banda may damage na brain. This can impact different aspects of speech physiology, respiration, phonation, articulation, resonance, voice quality, and pitch. Many different subtypes of dysarthria classification depends upon speech presentation. So now let's take a look at this example.
In item 10, dysarthria, we test the patient's articulation and clarity of speech. It's important that you don't explain the purpose of this exam. Ask the patient to read or repeat the words from the word card provided with the stroke scale. I'd like you to pronounce these words for me.
Mama, tip top, 50-50, thanks, Huckleberry, baseball player.
Okay.
For scale item number 10, this patient scored a 1. Let's look at how this scale item is scored. Score a 0 for patients with normal speech who read all words without slurring. Score a 1 for patients with mild to moderate speech defects and some slurring, but who can be understood.
Would you read those words for me, please?
Mama, tip top, 50-50, thanks, Huckleberry,
Good.
baseball player.
All right. Very good.
A score of 2 is reserved for the patient who cannot be understood in any meaningful way or who is mute.
Would you ask her to say mama? Ask her to say mama.
Mama. Di mama. Ma. Ma.
Okay. An unresponsive patient receives a score of 2 on this item. Patients scoring a 3 on level of consciousness 1A are scored 2 on this scale item. The item is untestable only if the patient is intubated or has other physical barriers to producing speech. Remember to clearly document and explain this problem on the form. If basic patients and patients who do not read may be scored based on listening to the speech they do produce or by asking them to repeat the words after you read them out loud. In some cases, the speech may be hard to understand due to dental or other non-neurological causes. Nevertheless, score the item a 1 to optimize reliability among examiners that might have varying.
Okay, so that is what we call dysarthria. Okay, they have the difficulty in expressing the word because they have the slurring, no, uh, like for example, 50. Okay, so there's a slurring. Okay. Now, dysphonia. Dysphonia is a term applied to voice, which can present as breathiness, hoarseness, low volume, abnormal pitch, or total loss of voice. Can be due to local lesions in the larynx, sometimes on the vocal cords themselves, like, for example, nodules, no? And reduced, it has a reduced breath support, reduced vocal cord adduction or abduction, vocal cord palsy, and infection. May co-occur with dysarthria. Okay, disorders which commonly affect voice are Parkinson's disease, multiple sclerosis, or CVA or cancer. Now let's try to look into this one. This is what we call dysphonia.
listen to this patient's vocal capability test.
Long ago, people found that it was easier to travel on water than on land.
Even louder, like you're saying, long ago.
Long ago, people found that it was easier to travel on water than on land.
This middle-aged woman had been having this voice problem for the past 5 months. The cause of the problem was unclear to the patient, and 6 sessions of speech therapy elsewhere had unfortunately not helped. But just minutes later, during the same examination,
Long ago, people found that it was easier to travel on water than on land.
the patient produces a normal voice. Why this seemingly sudden recovery? A look at this patient's vocal folds can help to show what is happening with her voice. Note the bowed vocal folds. This is because the patient is unnaturally posturing the folds and allowing them to go flaccid, as one might do, for example, to make a cartoon character voice. Thus, this patient's voice problem is not caused by any abnormality of her larynx's physical structures. Rather, her voice problem is caused by her abnormal use of those physical structures. This kind of voice disorder is called a non-organic voice disorder. To help this patient find her normal voice, the clinician guided her through a variety of vocal elicitations. How about just a plain yell? Hey!
Hey!
How about a siren? Start low and go high. And you do a fragments of the normal voice soon begin to pop out here and there. And do a A couple more minutes of this elicitation barrage, and then we get to this.
Long ago, people found that it was easier to travel on water than on land.
To lock in the patient's reestablished normal voice, the clinician prescribed daily positive-negative practice. In this so-called positive-negative practice, the patient consciously alternates between the reestablished normal voice and the old abnormal voice.
Okay. Long ago, people found that it was easier to travel on water than on land. Long ago, people found that it was easier to travel on water than on land.
And let's do the abnormal and normal every few words. That's maybe even harder to do.
Long ago, people found that it was easier to travel on water than on land.
Okay, so that is what we call dysphonia. Okay, so those are the different barriers of communication also, which is very important for us, for you as a caregiver or nursing aide or nursing assistant or healthcare assistant to understand what is happening to your patient if he speaks in that way. Okay, so there are some things that you really need to know, and maybe it will be developed by the person who is sick, like kung nagkaroon siya ng CVA, so dapat aware ka na posibleng magkaganito ang iyong pasyente. Okay? So, what would be your strategy for sa understanding, lalo na pagka may diferensya ang iyong pasyente, no? So first is check you have their attention before talking. Reduce background noise and distractions. Hindi na nga siya makapagsalita at hindi makarinig na maayos, tapos maingay pa. So you have to actually reduce the background noise and focus the attention. Okay. Then second is check hearing aids and glasses are being worn and make sure the other person can see your face. Okay. So dapat kung meron siyang hearing aid, ipasuot mo. Kung may eyeglasses siya, kailangan ipasuot mo rin para mabasa niya or maintindihan niya anong sinasabi mo. Speak clearly and slowly and use an appropriate tone of voice. So huwag ka talaga, lalo na kapag ka ang pasyente mo or may Alzheimer's, yung tone of voice mo is different. Okay? Kung medyo matigas ka, dapat medyo dahan-dahanan mo. No? Kasi uh, you have to speak clearly and slowly so that they can hear you clearly and slowly also. No? Be patient. Give the other person more time to absorb the message. Huwag yung ang bilis-bilis mong magsalita na hindi niya maintindihan pala ng sinasabi mo. Kasi yung pasyente mo, meron palang ganitong disorder. So, sayang yung time na yung mga sinasabi mo na hindi pala nag-absorb sa kanya. Now, use short sentences and familiar words. Emphasize the key word or phrase. So when you're going to enter the room and explain to your patient the procedure, huwag kang gagamit ng mga jargons na only doctors and medical practitioners or healthcare workers can understand. You have to use other words that a common person can understand you. Okay? So kung sasabihin na, ay may CVA ka po, ano yung CVA? Ang pinaka-intelligent, nag-stroke ka. Di ba? So may stroke. Ibig sabihin, nag-stroke pala. So you cannot actually use the words that the person cannot understand well. Okay? And then you have touch may be used to keep attention, give reassurance, and maintain contact. Now, pagka nawala na siya sa attention, pwede mo siyang itap ang kanyang shoulder. No, para maibalik sa iyo ang attention na yon. Okay? To maintain the contact. Check they have understood. Establish a reliable yes and no response. Did you understand it? Did you know that? Okay, can you hear me well? Can you understand this? Okay, so it's understandable na pag magsasabi ng yes, so talagang nag-aano siya, di ba? If necessary, repeat or rephrase your message. Kapag hindi niya naintindihan, ulitin mo siya sa panibagong paraan ng pagsabi. Baka hindi kanya maintindihan, sobrang lalim ng iyong sinasabi sa kanya. Try expressing the idea in different ways. Ayan. No? Hindi yung basta-basta ka magsasabi, pagkatapos hindi niya maintindihan, sasabihin, bobo pala ito eh. Baka ikaw ang talagang hindi marunong makipag-usap kasi yung sinasabi mo medyo malalim, medyo hindi naintindihan ng pasyente. So kailangan hanap ka ng way na maintindihan niya, no? Introduce the one idea at a time and use a keyword to cue the person to the topic of conversation. Like for example, may introduce ka, nagsasabi ka, may sinasabi ka sa taong yun, no? So kailangan i-introduce mo yung idea one at a time. Huwag yung basta babagsakan mo siya ng idea. Kasi hindi kanya maintindihan, sayang din yung mga effort na ginagawa mo. Tapos gumamit ka ng mga keywords, no? Gumamit ka ng mga keywords like for example, you mean like this? If the patient would say, I want to drink water. Okay. I want to take water. You mean you want to drink water? Ganon. Diba? So, I want to swim. Wala namang swimming pool. So, sabi mo lang na, you mean you want to take a bath? Okay? So, ganon. Then, the written word or drawing may help. Pag hindi kayo nagkaintindihan dahil sa mga words ninyo, then, i-drawing mo. Is this what you mean? Okay? Or, is this what you, isulat mo yung word. Is this what you mean? Kasi meron pala siyang dysphonia, hindi mo maintindihan. Or meron siyang aphasia, hindi mo maintindihan. So, ipasulat mo sa kanya or isulat mo. Or i-drawing mo para makaintindihan kayo. Use gestures pointing to real objects or pictures, facial expression to get your message across. Minsan gumagamit ka ng mga images, no? Ito ba yung ibig mong sabihin, apple? Ito ba yung sabihin mo, water? Ito ba milk? Ganon. So, kailangan meron kang ipo-point ng mga figures or images para mas maintindihan niya. Encourage them to support their talking with gesture, facial expression, head nods, and pointing. So ikaw mismo as a caregiver or nursing assistant, kailangan i-encourage mo rin yung pasyente mo na magsalita o di kaya mag-act ng gesture. No? Facial expression, is it painful? Okay, if it is very painful, you say like this in your face. Okay? Or if it is very painful, just say like this, head nod. Okay. Or now, can you please point which part of your body? Can you please hold which part of the body is painful? So you let the person to point which part of your body. Okay. Now wait. Give the other person plenty of time and keep the communication as relaxed as possible. Huwag mamadaliin, no? Kailangan bigyan mo siya ng tamang oras para makapag-response. If they can find the word, encourage them to talk around the word or describe it. Kapag ka hindi niya masabi, ikaw na mag-describe. You mean a color red? It's like a fruit? Hmm. You mean apple? It's like that. Okay, so but you have to encourage them. Okay, check if they want you to prompt. Okay, if you know the word they are searching for, give the first sound to encourage them to say the whole word. So, kunyari, no, nagsasalita siya, tapos hindi niya madire-diretso yun. No? So, pwede mo sabihin na, okay, you have to say, kung gusto niyo sabihin na, I want to go pa, I want some salad. You mean, sa, yeah, salad. Okay. So, you're going to guide the patient on what word they want to express. Offer a pen and paper to write or draw. Okay, bigyan mo sa kanya, can you write, can you draw? It's like this, okay? Now, if they have a communication aid, ensure they can reach it and encourage it to use. Okay? So, kung kailangan nila yung, like for example, hearing aid or the eyeglasses or, uh, there are some machines that can help them talk or can actually, no, meron ding gadgets na, so actually you have to encourage them to use that. Ask questions which require yes or no response and summarize as you go. Ask questions which elicit single word responses. Do you want a tea or coffee? Okay. Do you want a tea or coffee? Yeah. So if the person is having don't say, do you want to drink something? No, because they cannot express that one. So do you want tea or coffee or milk or water? Okay. So that is how you're going to ask question. If the person is having difficulty talking, it may be helpful to anticipate what they might want to say. Sometimes you have to be attentive. If what the person is or would like to express and he has the difficulty in talking, then you can anticipate. You mean like this? You want to say like this one? You want to go to the room? Okay, so just like what the baby a while ago, he cannot actually express himself, but the mother is talking to him, like helping the child to express himself. Say, so you want to go to the park? Okay, you say park. Okay, so don't pretend you've understood when you haven't. So when you're going to talk to the patient, and if you're not sure that you really got his message, no, if you're not really sure that you got the message correct, then don't pretend that you have understood. You have to keep on talking and you have to keep on communicating until you get the correct message. If you're getting stuck, don't be afraid to take a break. Things may be easier after a rest. Okay, so let's talk about in a little while. Okay, just relax because you are not actually able to uh, tell me already what is really what you really want to tell me. Okay, listen carefully. Reduce background noise, na sinabi natin kanina. Encourage the person to speak slowly, to give themselves more time to form the sounds. Ayan. Speak a louder than normal voice. No, louder but normal. Louder than the normal voice. Ibig sabihin, pero wag kang sumigaw kasi baka mamay masampal ka ng isang taong may meron siyang Alzheimer's, no? O di kasi ano yan sila, very reactive. Encourage them to fill their lungs and use their breath to make the words louder. So there is supposedly a proper training to do that. When forming their sounds, encourage them to make all the movements bigger than usual. They have to open their mouth. And you also have to open your mouth. Encourage the person to pause and breath when they need to and not when they are out of breath. So pag nagsasalita mabilis masyado at hindi na humihinga, hinihingal na, then you have to stop them. That's okay, just pause, pause, pause. Okay, and breath. So that is the end of our lecture, and I hope that you're going to study it. Okay, and as a prelude to our discussion later on. Okay, so see you in a little while.